more than $5 billion. But despite great need across the nation, there's been no federal reimbursement program for these pandemic-related losses to state and local governments, at least not yet. Every state suffered revenue losses just like Illinois. For months now, I have worked with governors of both parties and spoken countless times with members of Congress and the U.S. Senate to aggressively advocate for direct federal aid for state and local governments who have lost billions of dollars in revenue due to COVID-19. But while we wait for the Congress to act, and even without their support, governors must also work with the tools that we have to cover the COVID-related loss of revenue so that we can balance our budgets and support our residents in this time of great need. The stimulus that Congress may provide should be aimed at the challenges brought on by COVID-19, not the problems that states had that predated the virus. For many years before the pandemic, our state has had a structural deficit. And from the beginning of my term in office, I've worked hard to bring long-term permanent solutions to the table, including implementing efficiencies to lower the cost of government, reducing the budget pressure of pension liabilities, investing in the expansion of revenue-producing industries, and attracting our best students, our best future assets, to stay in Illinois rather than going to college elsewhere. And I'll certainly work to continue to address our long-term structural challenges in the coming session of the legislature. We must. Addressing Illinois' long-term fiscal challenges that existed when I became governor will continue to be among my very top priorities. But today I want to tell you about a portion of how we will address the short-term COVID-related fiscal issues that we face. The President-elect and the U.S. House of Representatives have pledged to provide state and local stimulus funding to assist us with the short-term deficits that COVID has created across the nation. Because there has been movement among a bipartisan group of senators to support that stimulus, our confidence level is rising, although it remains modest. In addition, the potential for delivery of vaccines in the coming months will help our economy recover, and therefore our state revenues may also see modest improvement. Those two factors improve the likelihood that we will receive help to overcome the short-term deficit that Illinois faces this year. As you know, the Federal Reserve is allowing states to borrow short-term funds to help weather the financial storm created by the COVID-19 pandemic. Back in May, when the budget was passed in the midst of the first wave of the virus, it was unclear how much potential short-term borrowing would be necessary. But we did know that it would likely be one of the tools that we would employ to help us manage our way through this challenging fiscal year. Although the General Assembly authorized as much as $5 billion of borrowing from the Federal Reserve, I am very reluctant to saddle our state with that large an amount of short-term debt. I believe it would be irresponsible to borrow that entire amount given the persistent fiscal pain it would cause over the next 3 years as we would struggle to repay that entire amount. Today is the day we must give notice to the Fed of the amount we intend to borrow. So in light of this pandemic's effects on our state's fiscal condition and my insistence that we look beyond this year to our state's longer-term fiscal condition, today we have notified the Federal Reserve of our intent to borrow only $2 billion, less than half of the $5 billion that's been offered to us by the federal government. This was a joint decision that I made after close consultation with Comptroller Mendoza and Treasurer Frerichs, and I want to thank them both for working together on this short-term strategy to manage the near-term financial challenges brought on by the pandemic. Our collective intention is to repay this line of credit as early as possible after either the awarding of stimulus by Congress or a sufficient recovery of state revenues. It is also important to recognize that we would not have had this tool available to us without the approval of the General Assembly back in May. Let me be clear. While we will continue to take every step we can to manage our way through this crisis, adding debt is not a long-term solution to structural imbalance. Short-term borrowing is a short-term Band-Aid to address the urgency of a short-term problem like one caused by a pandemic. Our long-term fiscal health must also be addressed, but not with short-term borrowing. I have been communicating with leaders and members of the General Assembly to get their input and best ideas to address the long-term fiscal health of our state. I intend to continue working with them over the coming weeks and months to identify the various means by which we will bring long-term stability and balance to our state's fiscal situation. Our goal with this short-term borrowing is to continue managing our backlog responsibly and fight to rebuild jobs and the economy over the coming year. It's my firm belief that short-term stimulus and near-term revenue recovery must be used to repay short-term borrowing from the Federal Reserve. So now moving on to our normal COVID update, I want to start with some good news. As of today, Illinois has tested more than 10 million specimens since the beginning of this pandemic, with more than 1 million done in just the last 10 days. That comes as we are now averaging more than 106,000 tests per day, also a new high for Illinois. Of course, for all that we've done to prepare our physical testing infrastructure for a surge, the simple limits of our laboratories during a time of immense demand across the nation, like we've seen in these days prior to Thanksgiving, have started to lead to longer lines and longer test turnaround times, even at our state labs. While we're doing everything in our power to meet the interest, I want to remind everyone that if you're experiencing symptoms, or if you had close contact with someone who tested positive, or just has concerning symptoms themselves, you should quarantine, even from your family, for 14 days. Remember, even if you test negative, it's possible that you were in fact exposed, and it's just too early for the virus to show up on a test. So don't think of a negative test as any kind of free pass. That's especially true going into this holiday weekend. The safest thing we can do for one another is stay within our own households. But if you are hell-bent on gathering with others outside your own home, please do it with just a few people. And importantly, this is not the year to have everybody over at grandma's house. I know this isn't what anybody wants to hear, but we also know that this crisis may come to an end in just a few months. Every day that we take action to stop the spread gets us one day closer to widespread distribution of the vaccines, with fewer lives lost along the way. Just as importantly, every day we throw caution to the wind, even if it's a holiday, is a day we backtrack on any progress that we've made for our healthcare workers, many of whom don't get to see their families on holidays in normal times. People like Becky Walfeld, the registered nurse clinical lead at Unity Point Health's ICU in Peoria. Becky has been a leader in setting up a new COVID care ICU at UPH Methodist, sitting at the bedside of sick patients with technology so they can communicate with their loved ones at a distance. Or Terry Lamar, an infection prevention and employee health nurse at Touchette Regional Hospital in Metro East. She has tested and educated countless employees and patients for the COVID-19 virus, dedicating countless after-work hours monitoring results and talking patients through their plan of care. Or Dr. Marianne Miller of the Javon Bay Hospital System in Rockford, who designed COVID-19 units in the spring while also providing direct care to patients. Dr. Miller is now hard at work designing alternate care models to help care for the many critically ill patients in Rockford during this second surge. There's too many for the hospital to support the same way as it did in the spring. So tomorrow, this weekend, and just a few months longer, think about Becky, Terry, and Marianne and their families. Think about your own family. Stay home when you can. Avoid gathering. Wear a mask. Keep your distance. And if you haven't yet, put your mask on and go get your flu shot. Doing so helps reduce the spread of that virus, helping our hospital systems better manage this pandemic by reducing the number of critically ill flu patients they have to care for at the same time. Shop small businesses online. And if you'd like, maybe start planning ahead for all the great celebrations and weddings and gatherings that you'll have when this is all over. We can get through this safely. We know how. So let's use the tools that we have, and remember, the best way through this is working together. Have a wonderful and safe Thanksgiving weekend, everyone. And now I'd like to turn it over to Dr. Ezike.
Thank you, Governor. And I just want to share that among the things that I'm most thankful for, Governor, is your steadfast leadership through one of the most trying times of our lives. So thank you. And for everyone, I want to wish you a happy Thanksgiving and a very safe one. I'd like to try to implore one more time for people who may still be planning that get together with multiple households and friends who are not in their immediate household to please, please, please reconsider. We don't want anybody's Thanksgiving dinner to turn into a COVID-19 super spreader event. Our goal is to protect and not infect those that we love and care for. My fear is that 2 weeks from now, we'll start seeing a new spike in cases or hospitalizations because people from various households gather to celebrate Thanksgiving. Please be a part of the solution and not part of the problem, and let's decrease the spread of this virus. Since yesterday, 11,378 new cases of COVID-19 were reported for a total of 685,467 cases in Illinois. Unfortunately, it was reported that 155 additional lives were lost for a total of 11,832 deaths just here in the state of Illinois. These are our mothers and our brothers and our sisters and our grandparents and so many loved ones who aren't going to be with us at the Thanksgiving table or any future holiday. 6,133 individuals were reported to be in the hospital overnight with COVID-19, and of those, 1,208 patients were in the ICU and 679 were on ventilators. In the last 24 hours, more than 114,000 tests have been reported, for a total of more than 10.1 million tests in the state of Illinois. And speaking of testing, if you do gather for the Thanksgiving holiday, remember to get tested afterwards. You can't test out of quarantine if you think you've been exposed, but please know that you can find a list of testing locations on our website, including the 11 community-based testing sites where anyone can get tested at absolutely no cost to you directly. Our testing sites are open on Friday, but of course, remember that you have to wait at least a minimum of 7 days after you think you may have been exposed to get tested. And as the governor said, if you're thinking of shopping, if you're shopping on Black Friday, don't forget your local stores and see if you can shop them online. And you can purchase gift certificates from your favorite stores and give it as a gift to be used in the coming year. While it will look different and perhaps not at all how we want, let's try to make this upcoming holiday season one of cheer and not one of fear for more COVID-19 illnesses and lives lost that could have been prevented. Have a safe, blessed, and happy Thanksgiving. And as always, wear your mask, watch your distance, and wash your hands. And of course, also get your flu shot. Thank you. Buenas tardes a todos. Antes de mañana, quiero mandar un feliz Día de Acción de Gracias a todos. También me gustaría pedir una vez más que las personas que todavía estén planeando juntarse con amigos y familiares que no viven en su casa, por favor no lo hagan. No queremos que las cenas de acción de gracias se conviertan en brotes de COVID-19. Adentro de una semana o 2 semanas, vamos a empezar a ver un aumento adicional en los casos, gente en el hospital y las muertes, porque personas de varias casas se juntaron para celebrar el Día de Acción de Gracias. Por favor, sea parte de la solución y no parte del problema. Y ayúdenos a frenar la propagación de este virus mortal. Desde ayer se han reportado 11,378 nuevos casos de COVID-19 para un total de más de 685,000 casos en Illinois. Esto incluye 155 vidas perdidas en las últimas 24 horas para un total de más de 11,800 muertes solo aquí en Illinois. Estos son madres y hermanos y hermanas y padres y abuelos y otros familiares que no se unirán a nosotros en la mesa de acción de gracias. 6,133 personas pasaron la noche en el hospital con COVID-19. De ellos, 1,208 pacientes estaban en la unidad de cuidados intensivos y 679 pacientes estaban en ventiladores. En las últimas 24 horas se han reportado más de 114,000 pruebas fueron hechas para un total de más de 10,1 millones de pruebas aquí en Illinois. Hablando de pruebas, si se reunirse para el Día de Acción de Gracias, tómese un tiempo después para hacerse la prueba de COVID-19. Puede encontrar una lista de sitios de pruebas en nuestro sitio web. La gente debe esperar 5 a 7 días después de que crea que ha estado expuesta para hacerse la prueba. Los sitios de pruebas estatales estarán abiertos el viernes. Y si está pensando en comprar el Black Friday, le recomendamos que compre en las tiendas locales por internet. También puede comprar un certificado de regalo en una de sus tiendas favoritas y dárselo como regalo para usarlo el próximo año. Sí, los días festivos se verán diferente y tal vez no será como queremos este año, pero tenemos que hacer lo más que podemos para salir adelante contra este virus. Tengo un feliz Día de Acción de Gracias y como siempre, sigan los 3 M's. Usan su máscara, mantenga su distancia y lávese las manos. Y también vacúnese contra la influenza. Muchísimas gracias para su apoyo. And with that, I'll turn it back over to Governor Pritzker.
All right, we'll start with some questions from reporters. We'll start with Greg Bishop.